Hi everyone, we will be presenting on myasthenia gravis.
Myasthenia gravis, also abbreviated as MG, is a long-term autoimmune neuromuscular disease that occurs when the immune system attacks the body's own tissues, which in turn causes weakness in the skeletal muscles. Myasthenia gravis also means grave muscle weakness in Latin.
Here are some terms that are commonly used when discussing MG. Autoimmune is when the immune system mistakenly attacks and destroys the body's own cells and tissues. This is the type of disease that MG is. Exacerbation is the flare-ups or when symptoms increase. Myasthenia crisis is when the complication of MG, characterized by the worsening of muscle weakness, results in respiratory failure. Refractory is when people with MG don't respond to treatment. This is about 10% of people who are diagnosed. Remission is when symptoms disappear.
The neurology of myasthenia gravis. The neuromuscular junction is impaired in a person with MG. So the same electrical process happens in these patients, but when acetylcholine is released at the neuromuscular junction, it is unable to bind to the receptor sites. This is due to antibodies produced by the patient's body that are blocking, altering, or destroying the receptors and preventing the muscle from contracting. There can be as much as an 80% reduction in the number of receptor sites available. The minimal number of receptor sites being active leads to muscle weakness and fatigue.
MG most commonly affects the muscles of the eyes, face, throat, neck, arms, and legs. In more than half of people who develop MG, their first sign and symptoms involve eye problems. This can manifest in symptoms such as drooping of one or both eyelids, called ptosis, or double vision known as diplopia. The double vision may present itself horizontally or vertically and improves or completely goes away when one eye is closed. About 15% of people with MG first display symptoms involving face and throat muscles, such as impaired speech, difficulty swallowing, difficulty chewing, or facial weakness and paralysis. MG can also cause weakness in the muscles of your neck, arms, and legs, which can affect how an individual walks and holds up their head. Dysarthria occurs in 10% of people with myasthenia gravis, usually younger patients, and dystonia, or voice disorders, occurs in about 2% of people with MG, usually elderly men. Voice problems involve vocal fatigue, difficulty controlling pitch, and a monotone voice due to one's inability to change vocal pitch. These voice problems can stem from poor breath support or weakness, which keeps the vocal folds from coming together properly.
The prevalence of MG is about 20 people out of every 100,000. That's approximately 36,000 to 60,000 cases in the US. These are estimates, but it's probably higher. It's common for MG to go undiagnosed. The frequency of the disorder has recently increased. This may be because diagnosis is better, identification is better, or that in general, autoimmune disorders are increasing all around the world. Associated symptoms of MG can be apparent at any age. However, they are commonly different between men and women. Women can notice symptoms around their 20s, 30s, and 40s, where men will see them later in their 50s and 60s.
As mentioned in the neurology slide, myasthenia gravis occurs when there is an error in the transmission of nerve impulses to the muscles, more specifically, the muscle receptor sites for acetylcholine. Though the cause of MG is unclear, researchers suspect that viruses or bacteria might trigger the above autoimmune response. It is believed that the thymus gland triggers and maintains the production of the antibodies that block acetylcholine. The thymus gland is usually small in healthy adults. However, in some adults with myasthenia gravis, the gland is abnormally large. Some adults with MG may also have tumors on the thymus gland called thymomas. These tumors are usually malignant, but in some cases may become cancerous. About 15% of people with MG have thymic tumors, and another 75% have thymic abnormalities.
Patients are often diagnosed after going to the doctor for extreme muscle weakness and fatigue. MG can be confirmed by a number of blood tests or electrical tests. Antibody tests are often used to confirm the diagnosis of MG. And here's a list of some tests that can be conducted to make the diagnosis of MG. So a physician may start with a physical and a neurological exam, and a physician will first review an individual's medical history and conduct a physical examination. In a neurological exam, the physician will check muscle strength and tone, coordination, sense of touch, and look for impairment of eye movements. An androphonium or a tensilin test. This test uses injections of the drug tensilin to briefly relieve weakness in people with myasthenia gravis. The drug blocks the breakdown of acetylcholine and will temporarily increase the levels of acetylcholine at the neuromuscular junction. A person with MG will see sudden, temporary improvement, while a healthy individual will show no differences. Doctors will also conduct a blood test. Most individuals with myasthenia gravis have abnormally elevated levels of acetylcholine receptor antibodies. However, in some individuals with MG, antibodies are not present in a blood test, and other diagnostic tests are used to diagnose the disease. They may also use electrodiagnostics. This consists of repetitive nerve stimulation to diagnose MG, as a doctor will repeatedly stimulate a person's nerves with small pulses of electricity to tire specific muscles. The doctor will be looking to see if the nerve's ability to send signals weakens and becomes fatigued with repeated stimulation. They can also use diagnostic imaging. They can use chest, CT scans, or MRIs to identify the presence of a thymoma or a thymic tumor, which Corbin just talked about as a potential cause of MG. Pulmonary function tests may also be used to measure breath support and strength and can help predict if respiration may fail and lead to a myasthenic crisis. Since weakness and fatigue are common symptoms in many disorders, MG is often missed or delayed in diagnosing, which Aaron just mentioned. Sometimes this can even be missed for up to 2 years. Patients with MG generally have a good prognosis with treatment and can lead fairly normal lives usually.
There are 4 main types of treatment. There are medications, cholinesterase inhibitors. They are used to enhance communication between the nerves and muscles. Corticosteroids inhibit the immune system. Immunosuppressants alter the immune system and reverse symptoms. It can take up to 8 months of treatment for results, and the results only last while taking the medication. Intravenous therapy is meant for short-term relief. Plasmapheresis filters the antibodies that block nerve signals to the muscles. Intravenous immunoglobulin therapy gives your body normal antibodies that alter the immune system. Monoclonal antibody treatment is used on patients who haven't responded to any other treatments. Surgery is an option. Some people with MG have tumors on the thymus and have a thymectomy. And the last type of treatment is lifestyle changes. This can include being active when your muscles are the strongest and changing your diet. An emergency plan should be put in place.
There are some complications that arise in clients with MG. Myasthenia crisis is probably the most noted complication in patients with the disease. Patients are often put on ventilators with either endotracheal intubation or through the use of a mask, and this can usually be prevented by being aware of symptoms and contacting your doctor with any changes in severity or frequency. So it's very important for patients to advocate for themselves in this way when symptoms do change. Some cautionary drugs that they need to be aware of are medications that are prescribed and over-the-counter prescriptions. They may actually worsen MG symptoms, so it's important for patients to check with their doctors before starting any new medication. Some of these drugs include certain antibiotics, beta blockers, which can be prescribed for hypertension or heart disease, and statins, which can reduce cholesterol levels. Vaccinations are also a complication. So people with MG have to be careful when giving live vaccines due to immunosuppressive medications that they may be on for treatment. Generally, inactivated vaccines are safe, so a flu shot, most of your vaccines are inactivated. So you would want to check with your doctor in that case too. Another complication can occur in pregnant women. So myasthenia gravis is rarely seen in infants, but a fetus may acquire antibodies from a mother who has MG. This condition is called neonatal myasthenia. It's generally temporary, and the child's symptoms usually disappear within 2 to 3 months after birth, but it can be passed in utero. So while there is no cure for myasthenia gravis, there are many ways to manage and live with it, and we'll discuss more treatment options in our next presentation.